Understanding mixed hearing loss. Role of the middle ear. Imagine trying to listen through a wall that blocks some sounds but not others. That's similar to what happens in mixed hearing loss, where both the outer or middle ear and the inner ear are affected. It's a combination of two types of hearing loss, conductive and sensorineural. Conductive hearing loss happens when sound cannot travel properly through the outer or middle ear. Sensorineural loss occurs when there is damage to the inner ear or the nerve that carries signals to the brain. The middle ear is a tiny but vital part of this process. It contains the eardrum and 3 small bones called ossicles. These bones are the malleus, incus, and stapes. They work together to transfer vibrations from the eardrum to the inner ear. When everything is working well, sound travels smoothly and hearing is clear. But if something disrupts this process, it causes conductive hearing loss, which can add to inner ear damage, resulting in mixed hearing loss. Common issues in the middle ear that cause conductive problems include fluid buildup behind the eardrum, often from infections like otitis media. This fluid makes it harder for the eardrum and ossicles to vibrate properly. Damage or stiffening of the ossicles, such as from trauma or a condition called otosclerosis, can also block sound transmission. If the eardrum gets perforated or torn, it can no longer vibrate effectively, reducing sound conduction. Additionally, if the eustachian tube, which helps equalize pressure and drain fluid, isn't working correctly, fluid can accumulate and cause further hearing problems. These middle ear problems are usually treatable. Doctors might prescribe antibiotics for infections, perform surgery to repair a perforated eardrum, or replace or stabilize the ossicles if they are damaged. Addressing these issues can significantly improve the conductive part of hearing loss. However, if the inner ear or auditory nerve is damaged, which is common with aging, noise exposure, or certain illnesses, hearing aids or other assistive devices are often needed. In mixed hearing loss, the middle ear issues reduce the efficiency of sound reaching the inner ear, while inner ear damage makes it harder to interpret those sounds. Understanding the role of the middle ear helps in diagnosing and choosing the best treatment options. It's important to remember that each person's situation is unique, and a healthcare professional can provide personalized advice. Proper treatment can often improve hearing significantly, but managing mixed hearing loss usually involves a combination of medical or surgical procedures and hearing support devices. Always consult a healthcare provider for an accurate diagnosis and tailored treatment plan.